So now I'm going to start a physiology chapter, and I like this one a lot, and I was studying it for myself, so I thought of making a video about it. So everything that we know about heart and uh, and a little more is going to just come up. The most important topic of heart for me is cardiac cycle. So we'll be doing the cardiac cycle in relation to heart sounds and murmurs. So, for the heart sounds part, heart sounds can be of two types. They can be normal heart sounds and abnormal heart sounds. That is what the doctor does, differentiates between the normal and the abnormal heart sounds. So the normal heart sounds are from the heart. From heart are S1, S2, S3 and S4. We can actually differentiate between S1, S2, S3 and S4. So we'll put up a line over here because we are going to differentiate between them. S1 and S2 are produced due to closure of valves. While S3 and S4 are produced due to striking of blood with the walls of the ventricles. Now the other type of heart sounds are the abnormal heart sounds. These sounds are also from the heart, of course, but they can actually be divided into two. They're from the heart, of course, and from the vessels as well. So from the heart and from the vessels. From the heart we have murmurs, clicks, snaps, pericardial rub, and pericardial knock. And from the vessels, we have brute and hum. One more thing, that S3 and S4 can also be abnormal heart sounds. They can be the normal heart sounds or they can be the abnormal heart sounds.